stop right there. Do not scroll past this. If you are on Social Security, if someone in your family is on Social Security, or if you plan to collect it someday, what you are about to hear in the next few minutes could be the most important financial information you receive all year. Because right now, as you are watching this, a series of changes are quietly rolling out across the country that are already shrinking checks, freezing payments, and blindsiding millions of Americans who had absolutely no warning it was coming. We are not talking about small adjustments. We are talking about people opening their bank apps and seeing hundreds of dollars missing. We are talking about letters arriving in mailboxes demanding thousands of dollars back. We are talking about people who did everything right, paid into the system their entire working lives, and are now being squeezed in ways they never imagined possible. And the most frightening part of all of this is that most people will not find out until the damage is already done. I am going to change that today. I am going to tell you exactly what is happening, exactly who it is hitting, and exactly what moves you need to make right now to protect yourself. This is Senior Authority, and this is the information that every American who depends on Social Security deserves to have. Before we go any further, if you are not yet part of the Senior Authority community, hit that subscribe button right now and turn on your notifications. This channel exists for one reason: to make sure that you are never caught off guard by changes that directly affect your money, your health coverage, and your financial security. New videos go up constantly, and every single one of them is built around the information you actually need. Now let us get into what is really going on. To understand the full weight of what is unfolding right now, you need to start with one number: 70 million. That is how many Americans currently receive some form of Social Security benefit every single month. Retirees who spent decades in the workforce, people living with serious disabilities, widows and widowers holding their families together, children who lost a parent. 70 million people who wake up every month counting on that deposit to pay rent, buy groceries, fill prescriptions, and keep the lights on. Social Security has been the financial foundation of this country since 1935, and for tens of millions of Americans, it is not just a benefit. It is the difference between dignity and desperation. That is why what is happening right now is not a policy footnote. It is a crisis unfolding in slow motion, and it is heading directly toward the people who can least afford to absorb the impact. So let us talk about what is actually happening, because there are several things converging at the same time, and it is that combination that makes this moment so serious. The first blow is coming from inside the Social Security Administration itself. The agency responsible for processing every claim, issuing every payment, and answering every question for all 70 million recipients has been hit with significant staffing cuts. Think about what that actually means for a moment. You take an agency already stretched thin, serving one of the largest programs in the federal government, and you remove a substantial portion of the people doing the work. Claims that used to be processed in weeks are now taking months. Phone lines that were already difficult to get through now have wait times stretching to hours. Field offices in communities across the country have cut their hours or closed their doors entirely, leaving people with no nearby place to go for help. The agency is not just slowing down. In many places, it is breaking down, and the people caught in that breakdown are not abstract statistics. They are real people waiting on money they need right now. The second hit is something that sounds almost invisible until you see it on your bank statement, and then it is impossible to ignore. Most people who receive both Social Security and Medicare have their Medicare Part B premium automatically deducted from their monthly Social Security payment. When that premium goes up, your check goes down, regardless of what happens to your benefit amount. This year, recipients were given a cost of living adjustment of around 2.5%. The government called it a raise. But the Medicare Part B premium went up at the same time, And for millions of people, that premium increase swallowed the cost of living adjustment completely. People who heard the announcement that their benefits were going up looked at their actual deposits and saw almost no change. Some saw less than before. And meanwhile, everything around them kept getting more expensive. Groceries, rent, utilities, medication. The math that was already barely working stopped working entirely for a lot of families, and the raise they were counting on turned out to be nothing more than a number on a press release. But of everything happening right now, there is one development that senior authority needs you to understand more urgently than anything else, and that is what is happening with overpayments. Here is how this situation works. Sometimes the Social Security Administration sends someone more money than they were technically entitled to receive. It might happen because someone's income changed and the update took time to process. It might happen because of an internal administrative error. It might happen because of a life event, a marriage, a move, a change in circumstances that was not captured in the system fast enough. At some point, the agency catches the discrepancy, and they send the person a letter saying an overpayment occurred and the money needs to come back. That process has always existed. What has changed so dramatically and so painfully is how the government is now collecting. In the past, there was a reasonable, humane approach, small amounts withheld over time, repayment plans that people could actually live with. That approach has been replaced by something far more aggressive. People are now seeing massive portions of their monthly checks withheld in a single shot. Not 10%, not 20%. In some cases, half of a person's entire Social Security payment gone. And the people this is happening to are not people who tried to game the system. They are not people who knowingly collected money they were not owed. They are ordinary people who received what the government sent them, used it to survive the way anyone would, and are now receiving letters demanding thousands of dollars back with no warning and no time to prepare. For someone whose entire monthly income is a Social Security check, losing half of it overnight is not a financial setback. It is a catastrophe. It is choosing between medication and food. It is falling behind on rent. It is the kind of shock that can unravel an entire life in a matter of weeks. And this is the part that senior authority is most determined to make sure every single person watching this video understands. You are not powerless if this happens to you. The system gives you rights, and those rights are real. You have the legal right to appeal an overpayment decision. You have the right to request a waiver, which is a formal request asking the Social Security Administration to forgive the overpayment entirely on the grounds that repaying it would cause you genuine financial hardship. And you have the right to request a reduced withholding amount if what they are taking from your check is more than you can survive on. If that letter arrives at your door, do not crumble. Do not assume there is nothing you can do and quietly absorb the hit. Read every word of the notice. Contact the Social Security Administration immediately and ask specifically about your appeal rights, your waiver eligibility, and your options for negotiating the repayment terms. There are deadlines attached to these rights, so move quickly, but move confidently, because the system does give you a path to fight back. Now let us talk about something that has been quietly eating away at Social Security recipients for years and is accelerating right now. The inflation problem that the official numbers simply do not capture. The cost of living adjustment is supposed to protect recipients from rising prices. Every year, the government measures inflation and adjusts benefits to match. But the inflation measure being used, the Consumer Price Index, does not accurately reflect how seniors and disabled individuals actually spend their money. Healthcare costs have been rising at rates far above general inflation for years. Housing costs have surged. Prescription drug prices have climbed to levels that would have seemed unthinkable a generation ago. And these are precisely the categories where Social Security recipients spend the largest share of their income. So when the government announces a 2.5% adjustment, it is measuring the wrong things for the wrong people. If your healthcare costs went up 8%, your rent went up 10%, and the prescription you cannot live without costs 6% more than it did last year, a 2.5% raise does not keep you even. It just means you are falling behind at a slightly slower speed. This has been the quiet reality for millions of Social Security recipients for a long time. A slow, relentless erosion of purchasing power that does not make headlines but shows up every single month in the impossible arithmetic of a fixed income. There is also something looming on the horizon that deserves an honest conversation, and that is the long-term financial health of the Social Security Trust Fund. The trustees of the program have been issuing warnings for years that without significant changes, the trust fund could be depleted sometime in the early to mid-2030s. That is not a distant hypothetical. That is within the decade. When people hear that, they panic and assume Social Security will simply disappear. That is not what would happen. Payroll taxes would still be coming in and could cover somewhere between 75 and 80% of scheduled benefits. But a 20 to 25% cut in benefits would be devastating for the millions of Americans for whom Social Security is their entire financial existence. This is not a problem that can be quietly deferred until it becomes someone else's crisis. It is a ticking clock, and the time to address it honestly is now. People trying to access Social Security for the first time are also running into serious obstacles. Because of the staffing reductions and office closures, processing times for new applications have stretched dramatically. Some people are waiting months before they see their first payment. Others are being asked to provide documentation that was never required before, creating confusion and delays that pile on top of an already stressful situation. For people applying for disability benefits, people who are already dealing with serious illness or injury and cannot work, the extended wait times are not merely inconvenient, they are genuinely dangerous. When you are too sick to work, and your medical bills are mounting and your disability claim has been sitting in a backlog for months, the consequences reach far beyond frustration. So, what can you actually do right now? The single most important first step is to create a My Social Security account at ssa.gov if you do not have one already. This gives you direct visibility into your earnings record, your benefit estimates, and the current status of everything on your account. Check your earnings record with real attention because errors in that record can reduce your benefits, and catching them early is infinitely easier than trying to correct them years down the road. The second thing is to treat every piece of mail from the Social Security Administration like it is important, because it is. Every letter, every notice, every statement goes into a dedicated folder that you keep somewhere safe and accessible. That paperwork is your evidence, your protection, and your leverage if you ever need to appeal a decision or dispute an overpayment. Throwing away letters without reading them is one of the most expensive mistakes a Social Security recipient can make. The third thing is to stay sharp about scams, because wherever there is confusion and fear around government benefits, criminals follow. You may receive calls from people claiming to be Social Security representatives, telling you that your benefits are being suspended and you need to act immediately. These calls are fraud. The Social Security Administration does not call people and threaten to cut off their benefits. They do not ask for your Social Security number in unsolicited calls. They do not demand fees to keep your account active. If you receive a call like this, hang up without engaging. If you ever need to verify something, call the official Social Security number yourself, 1-800-772-1213, and only that number. The fourth thing is to actually call your congressional representative. This advice gets dismissed more than it should. Congressional offices have dedicated staff whose entire job is to help constituents navigate issues with federal agencies, including Social Security. If your claim is stuck, If you are dealing with an overpayment dispute, if you cannot get the agency to respond, your representative's office can often intervene directly and move things forward. And when enough people call, when the volume of constituent concerns reaches a level that cannot be ignored, it changes how lawmakers prioritize these issues. That phone call matters more than most people realize. There is also a tax reality that catches people off guard every year, and senior authority wants to make sure you are not one of them. Depending on your total income, up to 85% of your Social Security benefits may be subject to federal income tax. Many recipients discover this for the first time when they file their return and face a tax bill they never planned for. The income thresholds that determine whether your benefits are taxable have not been adjusted for inflation since the early 1980s and 1990s, which means that year after year more people get pulled into the taxable range, even though their real standard of living has not improved. There has been discussion in Washington about eliminating the income tax on Social Security benefits, which would put meaningful money back into the pockets of millions of retirees. But as of today, nothing has officially changed, so plan accordingly and make sure you understand your tax exposure before April surprises you. It is also worth pausing to acknowledge the people who rarely get mentioned in these conversations: the family caregivers. Across this country, there are millions of sons and daughters, spouses and siblings quietly devoting enormous amounts of their time, energy, and money to caring for aging or disabled family members. Many of those family members depend on Social Security to help cover the cost of their care. When those benefits get delayed, reduced, or clawed back through an unexpected overpayment notice, the impact does not stay contained to one person. It cascades. Caregivers cut back on their own work hours. They draw down their own savings. They face choices that no one should have to make: their parents' medication or their child's needs. The human cost of what is happening to Social Security right now cannot be measured only in dollars. It is measured in the exhaustion and sacrifice of families doing the impossible every single day. And we cannot talk about all of this without talking about the people in the most vulnerable position of anyone in this entire conversation: SSI recipients. Supplemental Security income serves aged, blind, and disabled individuals with almost no financial resources. The maximum monthly SSI payment is already below the federal poverty line. These are people surviving on the absolute edge of what is survivable, and the strain on the Social Security Administration is hitting them just as hard as it is hitting everyone else, with even less room to absorb it. If you know an SSI recipient, a parent, a neighbor, a friend, please make sure they know their rights. Make sure they know they can appeal, request a waiver, and push back on overpayment terms that would leave them with nothing. They deserve that knowledge. Here is what all of this comes back to in the end, and this is what senior authority was built to stand for. Social Security is not a gift from the government. It is not charity. It is a contract. An explicit promise made to the American people: work hard, contribute throughout your life, and when you need it, the safety net will be there for you. 70 million Americans have kept their end of that promise. They showed up. They worked. They paid in year after year, paycheck after paycheck, decade after decade. They held up their side of the agreement completely. And now they deserve a government that does the same. That means payments that arrive on time and in the correct amount. That means an agency with enough people to actually serve the tens of millions depending on it. That means a system that does not punish recipients for its own administrative mistakes. And it means an honest, urgent national conversation about protecting the long-term future of this program before the clock runs out. This is not a Republican issue or a Democrat issue. It is an American issue. It touches every state, every community, every kitchen table. It may already be affecting someone you love. So here is where things stand today. Staffing cuts are making everything slower and harder to navigate. Medicare premium increases are eating away the cost of living adjustments that were supposed to help. Overpayment clawbacks are hitting people without warning and without mercy. New applicants are waiting longer than ever for benefits they desperately need. Inflation is quietly destroying the purchasing power that annual raises were supposed to protect, and serious questions about the program's long-term financial health remain unanswered and urgent. All of it at the same time. All of it aimed at the people least equipped to absorb it. But here is what else is true. You have rights. You have options. You have tools available to you right now that most people do not know exist. And you have senior authority in your corner, a community that watches every development, digs into every change, and translates all of it into plain language that you can actually use to protect yourself and the people you love. If this video gave you something valuable today, hit that like button right now and share it with everyone in your life who is on Social Security or counting on it someday. Your parents, your grandparents, your neighbors, the people in your life who need this information and do not know where to find it. Subscribe to Senior Authority and turn on your notifications because this story is not over. The changes keep coming and we are going to be here covering every single one of them. Social Security is a promise that 70 million Americans are counting on. Senior Authority exists to make sure that promise is defended, protected, and never taken for granted. Take care of yourselves. Take care of each other. We will see you in the next video.